Good evening. Thanks for tuning in to KSAT News at 9 here in the KSAT 12 newsroom. I'm Courtney Friedman. Coming up tonight, tens of millions of dollars in city programs suspended due to the effects of the coronavirus. A group of local anesthesiologists have developed a 3D printed splitter that would allow a single ventilator to help two patients at once. And a look at how drastically the pandemic is impacting unemployment numbers. But first, the number of COVID cases here in Bexar County is now up to 313. The death toll still remains at 9. Here's a look at how the numbers break down. For the first time, community spread cases outnumber travel-related cases. We now also know that 47 patients have made full recoveries. Meanwhile, test results from the Southeast Nursing and Rehabilitation Center have come back. That's the nursing home with a confirmed COVID-19 outbreak. An additional 59 residents have now tested positive there. $82 million in city programs will be suspended due to the effects of the coronavirus. This news announced today as the city is trying to figure out how to deal with the hole that's been created in its operating budget. Early projections put the shortfall between 62 and 81 million for this fiscal year. Among the programs that'll be suspended, the implementation of the Homeless Strategic Plan, as well as ambassador and after-school programs. The city's contribution to VIA will also be reduced by $3 million, but the biggest single item is putting $50 million worth of street maintenance projects on hold. We have not yet been able to determine exactly which projects will be affected. The city manager said they will move those budget items to next year.
Obviously, street maintenance will continue. That still leaves over $70 million that we have in production. Obviously 311 calls, potholes, emergency maintenance, we will continue.
The city will also undergo a hiring freeze with some exceptions for positions like 911 dispatchers. In response to a growing need for ventilators, a group of local anesthesiologists has developed a 3D printed splitter template. These doctors say it will allow a single ventilator to treat more than one patient at a time. But a group of national medical organizations don't recommend these devices and say there are other options that can be used during this crisis. Tiffany Huertas brings us both sides of the story.
The goal is then to take those two inputs and outputs from the ventilator and split them again.
Dr. Brian Lai is one of 4 doctors in San Antonio who created a 3D printable splitter for a ventilator. He says this could allow for more than one patient to use the ventilator.
That anyone in the world can download and print out right now and use on the ventilator.
You're going to take your Y piece.
Dr. Jennifer Arian says they saw many places running out of resources and they wanted to help.
It's more of like a temporizing measure. It's not meant to keep multiple patients on a ventilator for an extended period of time.
The president of the American Society of Anesthesiologists says splitting ventilators would be the last resort. Dr. Mary Dale Peterson says this technique is not recommended because patients need different ventilator settings.
Patients that have COVID-19 and progress to needing ventilation, a lot of them end up with what's called adult respiratory distress syndrome, or ARDS. And those patients are very difficult to ventilate and require sometimes moment-to-moment changes in the ventilator settings.
Dr. Peterson says there are other options that hospitals can resort to.
You might be surprised that anesthesia gas machines all have ventilators on them. And so since we canceled all these elective surgeries, we have a lot of anesthesia gas machine ventilators that can be repurposed to take care of ICU patients. We can also use BiPAP, CPAP machines. We can also use transport ventilators and home ventilators.
With cases going up every day, the local doctors say something needs to be done.
With the current projections in some areas, it could be a matter of weeks before they run out of ventilators.
For the 9, Tiffany Huertas.
And those anesthesiologists say this product is not FDA approved yet. They tell us they are working with the FDA to get an emergency use authorization. Helping San Antonio's homeless, the city and Haven for Hope say they're doing everything they can to make sure everyone has a shelter during this pandemic. The city says in the next few days, it will launch a hotline for people to call if they need services. Haven for Hope has closed its intake office. The shelter is filled at 1,700 people. To protect those already inside, they will not be allowed to allow any other new clients in. Some exceptions will be made, though. An example of that is families with children and for veterans. The shelter says it has stepped up its cleaning, too.
We've got probably 50 5-gallon buckets filled with cleaning materials, and they take 2-hour shifts and go all over the campus and clean surfaces, clean tables, clean doorknobs, chairs, anything hard that can be cleaned that people touch. We're doing that all day long into the night.
Shelter workers are also informing the homeless about the pandemic, since many of them don't have access to information. Anyone who would like to help Haven for Hope can donate things like cleaning supplies and hand sanitizer. Taking a look at cases in surrounding counties now, DeWitt County confirmed 2 new cases today, bringing the total there up to 6. Comal County also reported an increase today with now a total of 12 cases. Guadalupe County has at least 20 cases, Atascosa County with 2 cases. Meanwhile, Bandera County continues to report 0 cases. You can see your county's cases on KSAT.com. A big statement from Governor Greg Abbott today. Texas is expected to become one of the next COVID-19 hotspots. There are currently more than 4,600 confirmed cases in the state and at least 70 deaths. That being said, in an interview with KSAT anchors Ursula Perry and David Sears today, Governor Abbott said the rate of people testing positive for coronavirus is still less than 10% of the total people being tested. The governor also addressed when Texas is expected to see a peak in cases.
They are anticipating that the peak will be in the United States in about 2 weeks. From modeling that we are seeing, it looks like the peak in Texas may be about a week or 10 days after that. One reason for that is that it began later in Texas than it did in places like Washington State or California or New York. That said, if you look at the types of practices that have been taking place in San Antonio, as well as all of the metro areas in the state of Texas, you will see that we've had good distancing practices employed for about 2 weeks now.
The governor warned that the peak will be prolonged if people don't follow orders to stay home for the rest of this month. He also warned that there are consequences, including possible jail time, for people who refuse to comply. There are now more than 1 million cases of COVID-19 globally, and there are more than 52,000 deaths. The U.S., Italy, and Spain are the top 3 countries with the most cases. In the U.S., there are nearly 240,000 positive cases and more than 5,000 deaths. And the states with the most cases are New York with 92,000, New Jersey with 25,000, and now Michigan with 10,000. Let's turn to the 9 at 9 now. Kobe Bryant's book has been released posthumously of evidence of rainforests found in Antarctica, and to look at how COVID-19 is impacting communities across the globe. Here's tonight's 9 at 9. 2,000 plus ventilators in the federal stockpile cannot be deployed because the Trump administration failed to maintain them in storage. That's according to a New York Times report. The president said Tuesday the government is withholding 10,000 ventilators due to an anticipated surge in COVID-19 cases. However, the Times reports that 2,000 more units are out of commission due to the maintenance lapse resulting from a contracting dispute. A Department of Health and Human Services spokeswoman told the Times they accelerated the contract with a new vendor to make the unavailable ventilators available by April 30th. The New England Patriots team plane delivering badly needed N95 masks to Boston for workers battling the coronavirus. Massachusetts Governor Charlie Baker ordered the masks from China. He tweeted this photo of the plane being loaded with medical supplies. He says the state will receive more than 1 million masks. Late basketball legend Kobe Bryant's book has been released posthumously. It was created by Bryant and written by author Wesley King. Rainforests in Antarctica? Researchers say that may have been the case tens of millions of years ago. According to a new study, there's evidence that Antarctica supported swampy rainforests 90 million years ago when dinosaurs roamed the Earth. Researchers were able to pull a sample of sediment that revealed pristine samples of forest soil, pollen, spores, and even root systems so well preserved that they could identify cell structures. Here at home, UTSA is supplying personal protective equipment to UT Health San Antonio's medical facilities. Among the supplies, thousands of pairs of gloves, more than 200 face shields, and 1,800 surgical masks. NASA says the Hubble telescope has found the best evidence yet for the existence of an elusive and theoretical class of black holes. The white circle in this image pinpoints what's believed to be an intermediate mass black hole, or IMBH. This class of black hole has been difficult to find because they're smaller and not as active as supermassive black holes. It's believed IMBHs are the missing link in understanding the evolution of black holes. A local restaurant now selling household essentials amid the COVID-19 pandemic has added a new pop-up shop on the north side. Mi Familia de Mi Tierra pop-up shop is now available and open at the Rim. They will offer an array of items like toilet paper, fresh produce, sanitizing wipes, and more.
Anything that has to do with the community, we're there. In this case, we're trying to bring all the first need items, first necessity, such as toilet paper, items that are trouble getting at the store. We have them here.
Operation hours are every day, 10 a.m. to 6 p.m. A veteran in Oregon is marking two big milestones this week. The first, turning 104 years old. The second, recovering from coronavirus. William Lapshes, who lives at a veteran's home, is one of at least 15 residents who tested positive for COVID-19 in March. 2 of them have died. He was diagnosed at the start of March, was very sick, and took a turn for the worse after 8 days. His family feared he might not make it, but they're now celebrating his recovery. The bells at San Fernando Cathedral rang this morning for 1 full minute as part of an effort to recognize and remember people who have died as a result of COVID-19, as well as those who are still struggling with the illness. Mayor Ron Nirenberg also called for a citywide moment of silence. To read more about these 9 stories, head to KSAT.com.
Well, what a big change in our weather. Over the past 24 hours, we went from beautiful sunshine on Wednesday to very damp and gross out there today, but we are getting some much needed rainfall out of this weather. As we get into Friday morning, the drizzle and light rain will continue, but it's Friday afternoon that we have to shift our focus to a concern for some strong to severe thunderstorms, and we are going to get into the weeds on all that coming up here very shortly. Rain chances hang around through the weekend, and it is also going to be significantly cooler this weekend as well. So a lot going on in the forecast. We want to get you prepared. So here's a look at the overall severe weather risk for Friday. This is for storms beginning to develop early Friday afternoon and continuing through the evening hours. So all of South Texas, or much of South Texas, including all of the KSAT viewing area, is shaded in yellow. That means our severe weather risk is a 2 out of a 1 to 5 scale. So what this means is that a handful of storms are expected to become severe with threats of really hail and damaging winds. So breaking down the threats specifically, we're not really concerned about any tornado potential tomorrow. That's just not in the cards. This kind of setup that we're looking at, we're really looking at the potential for some damaging straight line winds, so non-tornadic winds. Those wind speeds could be up to 55, 60 miles per hour. We're also concerned about some larger hail that would be larger than 1 inch in diameter. That is bigger than the size of a quarter. And then as we get into the late evening hours, the concern for hail and wind will start to diminish, but then we'll start to be a little bit more worried about some flooding developing in isolated areas because these storms, as they dump a lot of heavy rain, that water could start to stack up, and we could see some isolated flooding issues develop by late Friday evening. So I want to show you what things look like on Futurecast. So we'll keep things fairly quiet overnight tonight through early Friday morning. More drizzle and light rain will be possible. Things will be staying cloudy, muggy as well. We get to midday tomorrow and still things are fairly quiet. But as we get to lunchtime, 1 p.m., we will be looking for some storms to develop, especially north and west of San Antonio. And this is where storms could begin to become strong to severe. And this concern for some scattered strong storms will be possible through the middle of the afternoon and even through the evening hours. I mentioned though, once we get into the evening hours, especially after sunset, not as worried about the hail and wind, but we'll start to become more worried for some isolated flooding issues across South Texas. So here's how your day looks tomorrow. Again, pretty quiet through the morning hours, but then as we get into the afternoon, scattered showers and storms beginning to develop, with some of those storms carrying the potential for some severe weather. Again, the main concerns being wind and hail. We'll keep you updated. We're going to keep you updated on all of our newscasts, including here on the news at 9. KSAT.com is going to be updated all day throughout the day. And we've also got alerts for you coming in on the KSAT weather app, so make sure you have that on your phone. So rain chances hang around through the weekend. 60% chance of showers and storms Saturday and Sunday. And behind this front that comes in tomorrow, look how much cooler we'll be this weekend. 62 on Saturday, 70 your high temperature on Sunday, so cool and damp over the next several days. Early next week, we'll start to warm up once again, but you see we've got rain chances in the forecast each day as our weather pattern remains unsettled.
Steve Priester is meeting with an ER doctor to answer your questions about the coronavirus. We'll be back in a minute.
Welcome back. Separating the facts from the fiction surrounding the pandemic and the fear. We're continuing this new portion of the News at 9 where we bring viewer questions about COVID-19 to the experts. Tonight, we're once again speaking with Dr. Robert A. Frolickstein, an emergency room doctor working out of Methodist Hospital right here in San Antonio. Doctor, thank you for joining us again. I'd like to take you're one of the first responders out there. You're kind of on the front lines of this whole thing, and we appreciate that and all that you and the people you work with do. What are you seeing right now in the emergency rooms?
So we're starting to see a little bit of an uptick in the number of patients coming in with illness consistent with COVID, and several of them have tested positive. And certainly there are some that are coming in that are have a mild flu-like illness that either probably don't have COVID and thankfully, again, certainly they're not sick enough to need to be in the hospital. And so we're able to discharge those patients.
Today, we learned that soon anybody, or not anybody, but people with COVID-19 symptoms should be able to be tested in San Antonio. SA Metro Health is expected to loosen the testing criteria. How big of a problem has access to testing been in San Antonio, and what would wider testing mean to you, the medical community, and to our city?
Yeah, so we're excited that it seems as though testing is going to become more widely available. For instance, just the example I just said, we've seen some patients in the emergency department that have symptoms consistent with COVID, but they're not sick enough to be admitted to the hospital. We send them home and say, we think you probably have that. It will be so nice that soon we'll be able to actually test them and say, you do have it. It doesn't really change the outcome, right? They're still going to go home, but we know from prior studies and that people who know they have a diagnosis are much better at doing the quarantining that is so much more so important when a patient does go home with that illness. And the same thing in the community. When the more we test and the more we can say you have it or you don't have it, it helps us to better control the spread of the virus in the community.
Right, people change their behaviors.
Yes, yes.
Next question, do mosquitoes spread the coronavirus?
There's no indication that it is spread by mosquitoes at all. It's very, very unlikely that it's even blood-borne. It's really through saliva, and so mosquitoes would not do that.
Next question, are there over-the-counter medications that would help with the symptoms of COVID-19?
So COVID-19 is a viral illness, and as most know, there is really no good treatment for viral illnesses. There are very few medications that specifically target and kill viruses, unlike antibiotics do for bacterial illness. Now, having said that, when you have any viral illness, what you would do is treat the symptoms. Tylenol is probably the best medication for the symptoms of COVID, just because, like any viral illness, you have aches and you'll have fever, and Tylenol or acetaminophen will help relieve some of those symptoms. And then the things that our moms and our grandmas always taught us: a lot of rest, a lot of fluids, those sorts of symptomatic treatments.
When we talk about how contagious COVID-19 is it as contagious as the measles?
No, it is not. The measles virus it's a much smaller viral particle. It's more easily aerosolized. That means it's hanging around in the air for a long time. And COVID is it's much closer in size and activity than the flu virus. Maybe a little bit more infective than the flu virus, but the measles virus is probably 3 to 4 to 5 times as infectious as the COVID virus that causes COVID-19.
The city of Laredo recently made a requirement that people who are going out, whether they're sick or not, should be wearing a face mask. Again, even if they're not sick. The next question is, should I be wearing a face mask even if I'm not sick?
So the reason In the community, if you stay, the 6 feet apart, then there's really no reason to wear a mask. Okay, the mask, if you are ill, then that mask may help prevent you from spreading droplets. But again, if you're 6 feet away, you're not going to get those droplets on anyone. And the same thing, if you're around someone that's sick, a mask may help you not get any of those droplets in your system, but staying 6 feet apart is much more effective.
Can this virus be spread through currency, through money?
So this virus, like almost any other virus, can exist on inanimate objects like money, like pens, like doorknobs. The real question is, and it's hard to ever answer this question, is how long does it stay there, and is it there in enough quantity to actually cause an infection? Is there enough viral particles there for a long enough period of time to come and cause an infection when I touch that dollar bill? It's probably very unlikely, but
yeah, okay.
Certainly is possible.
I always like to give you the last word in all of this. What do you want our viewers to take home with them tonight from this segment?
I think once again, I want to stress the importance of social distancing and staying at home. I know this is tough, but we still have, several more weeks of this battle, and staying home is the single most important thing to do. And that means really not congregating together, not going out on the basketball court and gathering around together. That's a very easy way to spread the virus. And it's thought that, if someone has an infection, first of all, they might not know it right away and still be spreading. But for every person that has the infection, they spread it to 2 or 3 other people, and then that web just starts growing. So stay at home, maintain the social distances.
I also want to put up the website for your particular group. Dr. Froelich-Stein, here it is, gsepem.com. We talked about it at 6 o'clock. But if somebody doesn't have a primary care physician or somebody that they can do telemedicine with or ask questions to, this is one of the many resources that are out there, correct?
Yes, sir, it is. And we'd be happy to talk to you, answer your questions, really aimed at should you go to the hospital. We're starting to see people not come to the hospital when we think they probably should be coming to the hospital. And so we want to help you answer that question. It certainly is safe to go to the hospital should you need to. We're very careful about protecting patients that are not at risk of COVID or we don't think they have COVID. So it's very safe. If you need to be there, please come. We can help you figure that out via telemedicine.
Dr. Robert A. Froelich-Stein from Emergency Room Doctor. That's his group right there from Methodist. Thank you very much for your time. We'll see you next week.
My pleasure. Thank you.
All right, we'll be right back.
Thousands of local unemployed people are unable to pay their rent due to the economic issues brought on by COVID-19. In response, the San Antonio Apartment Association came up with an emergency rental assistance program. They're asking the association's 1,500 members to forgive 25% of any past due rent, April's rent, and any late fees. The remaining 75% of the past due rent would be covered by the city's risk mitigation fund. The only thing left to do would be for the landlords under the San Antonio Apartment Association to cooperate.
Our owners are going to abide by the program and make the rent discount so that the money goes further for the city.
I won't look too kindly on landlords who are threatening their tenants right now, because our first step is to make sure that people aren't forced out on the streets.
Eviction courts may be closed for now, but that only means the process will be delayed. We have more information about the Emergency Rental Assistance Program right now on our website. Unemployment numbers across the country and state are reaching staggering levels. The coronavirus pandemic has crippled our workforce. RJ Marquez details the latest figures and tells us what help Governor Greg Abbott says is out there.
The amount of Texans that have applied for unemployment relief has skyrocketed. The Texas Tribune reports there has been a more than 1,600% increase in applications over the past 2 weeks. The overall numbers are grim. Last week, 275,597 Texans applied for unemployment. Compare that to just over 16,000 who filed in the week ending of March 14th of this year. March 21st was the first week where there was a spike in numbers. More than 155,000 Texans who were out of work applied for unemployment. And several people say it's been difficult to get through to the Texas Workforce Commission. The commission has been overwhelmed with applications and calls. Governor Greg Abbott addressed some of those issues on KSAT 12 Thursday afternoon. He acknowledged it has been a challenge.
There has never before been this many people applying for unemployment benefits. So what we have done, we hired several hundred additional new staff to help respond, and then we moved staff from other agencies to help respond. And so we are accelerating our timetable.
Before the coronavirus pandemic swept the state, some of Texas's worst weeks for unemployment was at the height of the Great Recession, which saw over 49,000 Texans file, and in the aftermath of Hurricane Harvey, when 63,700 filed. That pales in comparison to what we are seeing now, but Abbott urges Texans to continue to call the Workforce Commission and wants to assure them they will get help.
You're not going to be denied your unemployment benefits simply because you have not yet been able to make your application. But even better news, the unemployment benefits that you will be receiving will be more than what you would have otherwise received because of this additional money that's been appropriated by the United States Congress that will expand unemployment benefits in Texas.
The situation is just as bad around the country. The Labor Department released new numbers that show unemployment claims surged to 6.6 million. That doubled the previous record, which was just set last week. For the 9, RJ Marquez.
Here are today's top stories. The San Antonio nursing home with a deadly COVID-19 outbreak was rated much below average by federal regulators. Records show Southeast Nursing and Rehabilitation Center was fined $62,000 and was cited for 28 violations in 2019. The rating is based on health inspections, staffing, and quality measures observed during its last 3 inspections. Yesterday, the San Antonio fire chief announced one of the facility's residents had died as a result of COVID-19. Today, we learned 59 residents have tested positive. 6 staff members have also tested positive. And the San Antonio Police Department, a 3rd officer has tested positive for COVID-19. The deputy city manager announced that they were informed Wednesday night that the officer tested positive, but Metro Health officials are working to confirm that. The officer worked in the same unit as the 2nd officer who tested positive. Metro Health is conducting a contact tracing investigation. Meanwhile, a Bexar County Sheriff's Office detention deputy has tested positive for COVID-19. BCSO says the deputy reported having symptoms similar to allergies on Sunday. On Monday, the 12-year veteran abided by all COVID-19 mitigation efforts in place at the jail, which included a temperature check. There was no indication of a fever. The deputy is now on leave until they fully recover, and other deputies who were in close contact have been placed on leave as well. Today, Trinity University announcing changes when it comes to their application process. The university has implemented a 3-year test optional policy for standardized tests that includes the SAT and ACT. That means future applicants will soon have the option to exclude their standardized test scores from applications. The change comes after standardized tests were postponed due to the outbreak of COVID-19. The university's vice president of enrollment says the change is necessary.
Even if somebody does test, they don't necessarily have to submit their test to us. Testing is only the first in a series of hurdles that for all applicants trying to navigate this process.
The policy will apply to the fall 2021 class. It's Thursday night, which means it's time for another Throwback Thursday here at KSAT News at 9. This is the series where we take a look back at people and places that have helped shape our community. For more than a century, the University Health System has been providing care in the San Antonio area. RJ Marquez takes a look back at the history of the hospital system and its impact on families across South Texas.
Since 1917, the University Health System has stood tall as a beacon of the medical community across San Antonio and South Texas. The Robert B. Greene Memorial Hospital was University's first location and still stands today.
The first patient was admitted to the Robert B. Greene on February 2nd, 1917. So we're in our 102nd year anniversary.
San Antonio was in the midst of a population boom when the hospital was built. It served people who didn't have private health care. Around this time, an influenza epidemic hit San Antonio.
The hospital really cared for a lot of people in 1918 and saved a lot of lives because it was here at the time.
The hospital treated residents for decades, but funding was inconsistent for years.
University Health System saw a major change in the 1950s when voters approved the creation of the Bexar County Hospital District, one of the first in the state.
The vote, which created a tax to fund the hospital, gave University Health a new life and new direction. In 1965, officials broke ground on the Bexar County Hospital in the medical center.
The decision was made to ultimately build it way out here on the far northwest side of San Antonio. You know, in the early 1960s, there were a lot more cows than people in this area.
The hospital and a medical school, now called UT Health San Antonio, were completed in 1968.
That first class of medical students was, I think, about 225 medical students, and then I think there were like 17 residents.
Today, there are more than 700 resident physicians practicing at the school and across the network. The hospital has expanded by leaps and bounds. The latest phase of University's improvements started in 2008. The Robert B. Greene Pavilion opened in 2013 and the Sky Tower a year later, each addition made to accommodate patients during their stay.
Let's try to create an environment that is as, patient-friendly and warm and large enough for your family to come visit.
Hey everybody, thank you so much for coming over for another segment of Trending. Glad to have all of you guys over in my apartment. Feels pretty nice to have some company. We're going to be talking about a couple of fun stories on KSAT.com, but I'm going to start with the worst news first, but I don't want you to be too alarmed by it. Now, a study in China found that cats could potentially get COVID-19. Now, here's the thing is the study hasn't been peer-reviewed yet, and these cats were injected with large amounts of the virus before even showing up that it had the virus. So these cats could get it. The good news is they can't be very sick by it. Researchers say there's nothing to worry about. Your cat at home almost certainly doesn't have it, and it's almost impossible for it to be exposed to that much level of the virus in real life. So keep loving your cats, keep petting your cats. It's really good for stress, and we really need that right now. Speaking of stress, I wanted to show you guys a little bit about what celebrity chef Ina Garten did actually just the other morning. Now at 9:30 a.m., we're talking breakfast time here, Ina Garten posted on her Instagram an amazing cosmopolitan recipe. It's mainly amazing in its size. She made it in this huge glass. You have to go to KSAT.com to watch the full video, but it was a really funny video. She made this giant glass with, of course, a ton of vodka, a lot of other great ingredients in this cosmopolitan, and she, of course, is having a little bit of fun in quarantine like we all should. She said, you never know who will be coming over, and then she said, who am I kidding? Nobody's coming over right now. But we all relate to that, and we'll definitely drink to that with her. The last thing of the day, and this is actually some really good news. Now, South by Southwest was canceled, much to everybody's dismay. But the good news is they are partnering with Amazon to help put up its film festival online. And this is a really great thing. I know a lot of people were excited about South by Southwest and really bummed that it got canceled, but now you can kind of salvage some of it back by watching these things on Amazon Prime. Here's the best part. You don't need to have an Amazon Prime membership to watch the movies here. So maybe culture yourself a little bit. You'll be home anyways. Why not watch a bunch of best movies that would have been on in Austin anyways? So that's pretty much it for Trending today, and y'all take care of yourselves.